I first met Amos in March this year at the Greater Accra Regional Hospital. He was suffering from chronic kidney disease. His family scraped through to pay for dialysis, which cost 360 cedis per session thrice a week. This translates to 1,080 cedis a week and 52,160 cedis a year.
My parents are forcing to get some money, but still they haven't get nothing yet, so I need your help.
He died less than 6 months after meeting him. Amos is not the only one. I interviewed Fidelis in August 2020. She needed money for treatment for urine incontinence.
Me go school and I'm
Before we could even raise money for her, she also died because her parents did not have money to pay for a lab test during an emergency. Her family is distraught. So did Sarah Ankra. She did not get $30,000 for kidney transplants and died. Collins was buried on Saturday. He had bone cancer. Unfortunately, he could not raise $25,000 for treatment. The list of persons who died while awaiting funds for treatment because the NHIS does not cover their ailments goes on and on and on.
It's a very disturbing trend and a very worrying situation, but it's not new to us at the GMA. Doctors meet this day in, day out, where for some people of a certain social standing, some disease or diagnosis simply is a death sentence, because if you squeeze them, nothing comes out. And sometimes it's so frustrating. And most doctors will use their money to support with minor things, but when you get something that's running into thousands of dollars, then it becomes like a death sentence, because they'll contact family, they'll do everything, and nothing comes out. But it's a reflection of what our society has become. Unfortunately, there are no safety nets.
Kofi and his family have traveled all the way from Kentampo to the Korle Bu Teaching Hospital in Accra. Their first time to seek medical help for their daughter with a heart problem. Even money to feed themselves is a challenge. Kofi tells me they've sold all their property. It's risky to appeal for funds on television because his debtors will contact him. He first issues an apology to them. He needs 800 cedis for a scan, an amount he cannot afford. He needs to feed his daughter. While he's away, his wife resorts to prayer for God to intervene in her daughter's situation. Fortunately, the TV3 newsroom raised the money needed for the scan. In November, I took Kofi and his family to the Akai clinic for the scan. Nanaya has successfully undergone her scan here at Akai House. Thankfully, Akai House decided to do this for free due to her condition. We are hopeful that from this place would go to the Korle Bu Teaching Hospital for further diagnosis from her medical doctor. Fortunately, Akai Clinic decided to bear the full cost of the scan. Kofi is happy. He can use the rest of the money raised to feed his family while in Accra. The increase in people resorting to GoFundMe, the media and total strangers has a lot to say about the country's healthcare system. Some Ghanaians are finding it difficult to pay for critical, life-saving surgeries and treatment. If you have good health, do not take it for granted.
This is all your mamma 200 million. Me need 200 million. Me ba mu yejuma. Me nebi.
Portia Gabor, TV3 News, Accra.